I felt like I was at home. I felt like I was talking to family. It was great and it was comfortable, and I knew this is where I wanted to be.
I think the one word that helps to define TCU's program is opportunity. The resources for students in the nurse anesthesia program here at TCU are vast.
One of the main reasons I chose TCU for my anesthesia school is because one of my coworkers went to the program, and she talked so much about how much she loved the program. She loved the professors and how well they taught and how much they cared for the students. She talked about how great the facility was, the simulation lab was excellent, and the anesthesia machines that they got to use were just like the ones that they use in the hospital.
The curriculum at TCU sets up our students for success and offers students a unique experience in that the first 2 semesters of the curriculum are asynchronous and entirely online.
I was able to work the first 2 semesters of the program and take online classes so that I could continue to work and save money, as well as spend time with my family before starting didactic. When it's time to start didactic, you'll be moving here to Fort Worth, and you can just go to class and you can focus on your materials and your schoolwork before clinical.
For anyone applying to CRNA school, I would tell them to be ready to be humbled, but to grow in incredible ways.
I was terrified when I first started CRNA school. You always hear about how demanding it's going to be, and the staff here is just so amazing, from the professors to the front office. Everyone involved in the program is just so welcoming and helpful, and they really set you up for success and make it achievable.
The practice settings of the faculty here at TCU include the military, rural and urban settings, overseas missionary work, and a multitude of cases in all specialties. That collective experience is brought to the classroom and the education arena every day that our students sit in the classroom.
The simulation lab at TCU is a great experience because it allows you to have a little hands-on time before you get to actual patients.
Our simulation lab is high technology and top of the line, and we also have access to a cadaver lab in which we can experience some hands-on anatomy procedures to get familiar with what we're learning in the classroom and in our textbooks.
This allows students to get hands-on cadaveric experience in learning the anatomical components critical to the profession of anesthesia.
We partner with Maverick Anesthesia, and they run a class using both live models and cadavers to do a regional anesthesia block class.
Students are given very unique and individualized instruction in ultrasound anesthesia, as well as in our Advanced Pain Management Fellowship to CRNAs who seek certification in advanced pain management, which is an ever-evolving subspecialty of the nurse anesthesia profession.
We're going to make sure our students have quality and not just quantity. And that means we have enough clinical sites for everybody to have an awesome experience. We have rotations for you in pediatrics, neuroanesthesia, cardiovascular anesthesia, and also opportunities to learn regional anesthesia and some of our rural all-nurse anesthesia practices where you have an opportunity to practice outside of the larger academic medical centers. We have clinical sites that range from Anchorage, Alaska to Tampa, Florida, and everywhere in between.
Our clinical partners are always eager to train our nurse anesthesia residents at our 50+ clinical sites in 7 different states. On average, our residents graduate with 900 clinical cases in all specialties.
Our faculty really wants us to succeed because they know that we're going to be the future of anesthesia. We're going to be the ones that are performing anesthesia, possibly for them, possibly for their family members.
Upon graduation from the TCU School of Nurse Anesthesia, our graduates are 100% employable. TCU Nurse Anesthesia graduates have consistently been above the national pass rate for certification and have maintained a 100% pass rate on the national certification exam since this program's inception in 2003. I'm confident that students who come to TCU and become Horned Frogs leave TCU knowing they've been someplace magical.